Do you complain of leg pain or notice that your legs move a lot? Does your child complain of leg pain saying they hurt? I often see this concern amongst my adult and young patients in my medical consultation. Firstly, to rule out whether your child has an acute or chronic problem, we must conduct an inquiry and a thorough examination. In the inquiry, we will ask about the type of pain, how long it lasts, when it occurs, and what the child does. Also, how long they've been experiencing this pain. Secondly, during the examination, we will assess whether there has been any trauma, impact, hematoma, skin injury, subcutaneous inflammation, or bone damage. For this purpose, we have tests like X-rays, ultrasounds, or MRI scans. Once it's determined that there is no acute pathology, we will consider a chronic condition, and there we have two syndromes, the hypermobility joint syndrome and the restless leg syndrome. Hello, I am Dr. Navarro, a pediatrician, and in this video, I will talk to you about restless leg syndrome. This syndrome is characterized as a neurological syndrome with neuromotor features in which there is chronic pain accompanied by a need to move the legs. This occurs after intense pain, especially during periods of rest, while sitting or lying down. These symptoms worsen in the evening and at night, usually until around 3 in the morning. Between 3 and 5 in the morning, the pain disappears, and during the day, children do not notice it. They describe a sensation of pulling, bubbles, and a need to rub their legs as if someone is tugging them. This sensation is relieved as soon as they start moving, especially by walking. So, what are the causes of this syndrome? We will consider 3 causes. Firstly, the genetic factor. It's estimated that 70% of children have first-degree relatives, usually their parents, who have the same symptoms. Others may not be aware, but they move their legs a lot while sitting or lying down. Another cause is a decrease in dopamine, a neurotransmitter essential for motor movement. This decrease is related to iron, which is necessary for dopamine production. The third cause of restless leg syndrome is a decrease in iron or ferritin, which serves as the iron storage in the body. If ferritin levels drop and dopamine decreases, a decrease in iron is suspected. This can be assessed through blood tests. There are also cases where children with normal or high ferritin levels have the syndrome, suggesting an iron deficit in the central nervous system, where dopamine is produced. And how can you notice this restless leg syndrome in yourself or in your child? The key to diagnosing restless leg syndrome is to evaluate your child at dusk. Pain usually starts at that time, with intense pain in the legs. Children need massages and movement, have difficulty falling asleep, and frequently complain of leg pain. They might also need to get up and walk. It's important to differentiate it from other syndromes, such as hypermobility joint syndrome, growing pains, fibromyalgia, depression, and anxiety. For a full medical diagnosis, then blood tests need to be done to rule out anemia and evaluate iron and ferritin levels. Additionally, a polysomnography, a sleep study, can assess the quality of the child's sleep. If your child has low iron and ferritin levels, it will be necessary to give them iron supplements until appropriate levels are reached. The use of melatonin to induce sleep can also be considered. Other measures like massages, yoga, and relaxation can improve their rest. It's also advisable for them to stay active during the day and not too active at night. Avoid heavy dinners at night, as well as exciting substances like chocolate, caffeine, and sugars that can worsen restless leg syndrome. Thanks for watching, and if you like this video, give it a thumbs up and subscribe for more. Don't forget to hit the notification bell.